Hey guys, how's it going? Hey Robertson or Jesse. Hey Ashley. Hey Rub. Hey Zen. Hey Sunshine, how's it going? Hey Rockin. Hey Crafty. Hey TikTok Mom, what are you doing in here? You already passed. Hey Sharda. Thank you for the likes, Jesse. Hey Belinda. Hey Queen, how's it going? Good to see you. Hey Canna. Hey Diaper Dog. Like that. Hey Millie. Hey Casso. Just here for some little encouragement. You're awesome. You're awesome. Hey Sarah. Hey Baking. How's it going? Hey Annie. Good to see you, Sarah. I have some urology to do today. I was playing around with the questions. Even I get bored with what I'm doing, and so it'll be an interesting little presentation tonight anyway. I am in the 2023 book right now, just marking up some do nots while I had a second. We got a do not use a modifier on all these codes. If you're in the 2023 book, I'm on page 265, just playing around, waiting on somebody else to show up. Sunshine, you passed too, but you're still here learning. Aw, great dedication. Hey, Vina. How's it going? I like to teach from the exam point of view so that you can learn. You start a new job this week. How's it going, Annie? So I'm not like really teaching like a whole bunch of coding cool info for you guys after you pass, but hopefully I'm helping a little bit. Hey Zen. Whoops. Sitting here trying to scroll up. You're testing on Wednesday, trying to get in a few more lives. Good job, Ashley. That's awesome. I got some really good words I think I can say to you that can help. Learning about auditing too. Yes. That's where you really want to go. I mean, coding, it's a great job and it's, got good benefits and good income and stability no matter what. Healthcare is not going anywhere. So it's awesome. It's just coding. Ugh. It's nothing I ever wanted to do. I do love auditing because it's a challenge. It's like finding a needle in a haystack, doing puzzles. I like that kind of stuff. So, no school at all, C.D. Smith. Don't take a course. Absolutely not. I love auditing. Thank you, Sharda, and others who are gifting the stockings for Christmas. Love it. Thank you so much. I really appreciate it. All that money goes back to you guys to give out free stuff. Speaking of free swag, you're trying to finish your AAPC course and E&M is driving you nuts. I bet it is, Sunshine, because it's the last section and you've already been through the entire course and you're exhausted and then they give you E&M. Lord. Hey, Lisa Marie. I did a high school. I did a high school report on Lisa Marie Presley and I had to dress up as her that day and do a presentation and speak in front of the school. Oh, I still have PTSD every time I hear Lisa Marie's name. I still think of that. It's actually, I think I did okay, but still. Hey, fantastic. What'd you say about tomorrow? Time management continues to be a biggest problem. It wouldn't be if you were not reading the questions. Do not read the questions. You have been programmed since first grade, since you were able to read, to go read the questions first, then look at the answers. You need to fight Mother Nature or human nature that has been brainwashed into your head, that is the only way to tackle any questions is to read the question. Don't do it. Don't read it. That will help with time management. If you're not reading the questions, then you've got just 100 answers to look through, not 100 questions and 100 answers. So everybody that follows that usually ends up passing and walks out of there 40 minutes ahead of time. And that's what you want to do. Please do not use that 40 minutes to second guess yourself. If you have one or two questions that have bugged you ever since you saw them, and you want to go back to those, then great. But do not just randomly go through your entire exam and look at everything. Don't do that, please. With your 40 minutes, walk out, go home, go have a drink, whatever. Go have a cry in your car, whatever. But don't go through the exam again. Hey, Go-Kart, how's it going? We did a little group tutoring today with a few people. Hey, Christy. Jen is so right. Don't read the questions. Take a blank index cover card. Yep, and cover it up. I have one of these things that my son made me on a 3D printer we have. It can hold your cell phone in it. But yeah, absolutely. Take something to cover up the question and just go straight to the answers. Absolutely. That will help you out so much. If I missed your message on, I'm sorry, but hopefully somebody else can help answer. Hey, Veen, thank you for the TGIF. I scheduled to take my exam tomorrow morning. I'm so nervous. No worries, Dana, I am going to help you out. I'm going to give you some great tips. So in cardiology, since I'm sitting here, one of the main things is make sure you know whether you are doing an artery or a vein. Most of cardiology is just simply divided into that. Look at your question just as a word search. Am I doing a procedure to an artery or am I doing it to a vein? Now, just because your route into the body is an artery or a vein, that don't mean nothing. But what is the procedure I am doing today? And am I in an artery or am I in a vein? And even the cabbages are separated out that way. You'll have all these venous cabbages, then you'll have the artery cabbages, and then in the middle, you'll have a combo that is artery and venous, both. And that's 75% of your issue. Just figure out if you're artery or venous. Digestive system, those hernias in the back, last page. Figure out if you are laparoscopic or if you are open surgery. The 96s, the 496s are laparoscopic. The 495s are open procedure. Figure that out first. If you start out with a scope and then you end up opening up the patient and finishing the procedure with an open procedure, then it's going to be a 95. Super easy. Urology. Where is urology for today? That's the one I'm working on with some cool questions. This is the wrong book for me. And can't do anything without a book updated. Yeah, we're not there. Digestion. I know male and female. And then urology is right before it. All right. The main thing here that will save your soul in urology is to label every page in urology. So, what are these pages taking care of right here? Meaning, what am I working on? What body part here? I'm doing a neph. See the neph? N-E-P-H. Neph means I'm working on what type of body part? I'm working on a kidney or aka renal. Next page is kidney also. This one's kidney also. We get to ureters when we have a header that says ureters. Where is that? That's all renal. That's all renal. Repair, laparoscopic, ureter. It's near the microscope one, right here. Right here. This half of the page is going to be kidney, because these codes right here are kidney still, kidney renal. And then this side of the page is ureters. So look and see what I am doing in that question. Am I working on the kidney? Am I working on a ureter? And then the next thing is going to be bladder. Bladder starts in a couple of pages around endoscopes. So we'll keep going until we see something called endoscopes right there. Endoscopy is at the 5-1 code. 510. 510. Yeah, 51070s. Yep, right around in here. We got the endoscopes at 50950. We're going to be bladder with these pages. And then the next pages we'll be doing bladder and urethra around the 5200 mark right here. This area is going to be urethra and the bladder. So first thing ever in urology, no matter what repair am I doing on what organ is all you need to know. If it's just bladder, then great, you know you're back here. If your urethra, you're working on it and the bladder at the same time, then you know you're back here. If you're only working on a kidney, then you're up in the front. That will help out so much during the exam. Really a whole bunch. Thank you for the holiday stockings. That's awesome. You are great. Thank you, Sunshine. Hey, Lady Love. Good to see you. Can you tell something about separate procedures? I absolutely can. So let's find an example. Let's see. Separate procedure. Let's see. Let me just try to find one on the fly. Here we go. Right here. So what they asked about was some of these codes have this thing in the parentheses that says separate procedure. And I can't help it. If I got out a yellow highlighter, I'm going to highlight everything I see in a parentheses. So what this means is usually it's the very first code in a sequence of something. So this whole section of excisions means removal. We're excising something. It goes over here to this one. And then that separate procedure would stop right here at another header. So everything here, no matter whether it's a mama or a child code, if we did it and we're still inside this area, it includes a biopsy of the wee here. I don't know what I can say on TikTok. So no matter what, even if we are doing a removal of a foreign body and we do a biopsy at the same time while we're there because we see something interesting, that separate procedure is included in anything of these things. Now, if for some reason your doc does do, I don't know, a repair of an incomplete circumcision, but then also goes inside the wee-wee and doesn't use that foreskin, does something else and does a separate biopsy because they see something maybe like a herpes or some other kind of growth that they're concerned about, that they're doing a separate evaluation for, you can bill it. You will need to attach, this is the second procedure with the 59 modifier. If it truly, truly is a totally different thing than the circumcision. We're not talking about the foreskin. The foreskin on any circumcision automatically goes for a biopsy. Y'all know that. But if, like I said, he has herpes or some other kind of growth that looks so abnormal and it concerns the doctor, then we can do a separate biopsy with the circumcision, and we just have to make sure that our documentation is clear. So that's what separate procedure means. No matter what part of the book you're in, it could be anywhere. I could be anywhere and see the word separate procedure. Then that means everything that's in its header will include that procedure anyway. Let's see if I can find one in eyes. I'm sure there is something around here. There's one. Modification of ocular implant with placement of pegs. Blah, 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 blah. Procedure, separate procedure. That's modification of an ocular implant. So if we're reinserting an implant, of course, modification is included. If we're doing a removal of an implant, modification of that implant is already included. Those kind of things. So, kind of interesting. I hope that's helpful. Does that help? Most often you don't code it separately, but if by chance, like in that urology example I gave you, you truly did do a separate procedure where you did a biopsy on something that was not related to a circumcision, then yes, you can code it separately. You just have to make sure your documentation and your chart is valid for that. It's just a reminder that the first code in this sequence is the smallest of all the procedures, and it's usually something that is included in all the other procedures in that area, but it's just such a minor, usually, procedure that it's already included in everything else that's under the same header. That's all. Some commercial payers want XU instead of 5.9. That's totally correct. Yep, I am not a biller at all, or a coder. I do Category 2 audits in my career. I love that. I like those codes. Those are in the back of your book. We don't use them very often during the CPC exam, but every so often you do. I do where doctors are supposed to code like the systolic and the dystolic of your blood pressure. If you have a 120/80, they have a code for that. If you have your hemoglobin A1C checked and your doctor reviews it and your result was 10.0, they have a code for that. It's all back here in the back of your book. And it's used to capture clinical information that the doctors are reviewing during their exam. And it also gives the health insurance direct information about how your health is without getting a copy of your records and then having some MD look at your hemoglobin A1C and see that it is high at 10.0. They've already got it because it's a code So they're just turning everything, medical records, making sure you got your colonoscopy. A depression screening is here to see if you've ever been screened for that, which you should. Everybody should. Even the kids, they're doing those to kids nowadays. Just everything is all back here. Advanced planning. Did you get your advanced directive filled out? That's why they're always bugging you at the doctor's office, because if they can get you to fill it out, then they can bill this code. It doesn't do anything financially for them, but like in California, where I work out of, you can go to the california.gov website and you can bring up your medical group's report card, and you can bring up any doctor's office group's report card, and you can see, do they take care of patients' advanced directives? Do they take care of patients' mental health screenings? And they get reported for doing so much of their population's depression screening. If they're getting 80 and above, then great, they get 5 stars. If they only do 2% of their population, then they're getting 1 star, which is poor. And so that's what I deal with, is these codes back here. You'll have to look more into that section. Yeah, I like that section. It's not got anything to do with billing or collecting money from patients, and it's just making sure they're getting their screenings. So I like it. As an empath that I am, I don't like anything that bills. I don't think, I think we ought to be like all the other countries in the planet and provide services for our entire population instead of only the working class can get health care, but then they can't take off work to get it because they can't get off work. Anyway, I don't know. It's crazy how we do stuff here compared to other countries. And our health care is so funny because all of our ICD-10 and HCPCS codes and everything that we bill, you know where we get it from? We get it from Canada because they've already done it. They created all the coding and all that stuff. And yeah, it's so funny how everybody wants to not do universal care, but all these guidelines, everything that your health plans tell you can and cannot have, and all those measurements, like you gotta be, if you're 21 to 29, you can only have a pap smear every 3 years. Well, that was drawn up and done by Canada. And anyway, we just adopt those through CMS and AMA. And then we adopt them and make them commercial here. And we make people pay for it, even though we got it from Canada. So funny. Anyway, I have a lovely, lovely case. And I was bored with just my original stuff where I put, the answers. And then the question, sometimes I like to get creative and make it look like a kindergarten thing. But I get bored with the same thing. So I made a little thing for a case today. I have 3 cases. 2 of them are urology with diagnoses and CPT codes. And then one of them is E&M case for you guys. So hopefully this will be fun. Just looking at the diagnosis without looking at our case that's in the middle, if you were using my process of looking for similarities, and I'm sorry I can't pay attention to the screen while I'm teaching, but keep posting your stuff and tapping away. The girls that are mods here can help out and answer questions. But just looking at these diagnoses, which 2 would you keep and which 2 would you throw away? While I'm getting a drink. I worked, I don't know, the first 3 years at the current place I work at right now. I've been there over 12 years now, almost, well, yeah, January will be 12, I think. Next to the referral department director, and she always got the difficult cases like the lung transplants and stuff. That woman reveled in denials. She loved looking up local determinations and finding clauses that could get our group out of paying for big major surgeries. She absolutely loved it. It made her day. And I still can hear her cackling. It just tears me up. She loved it. She loved her job. Absolutely loved it. Ooh, I was so glad when I got to go home and be remote. Some people love looking up that stuff, and it's like, finding, it's a puzzle, looking through those local determinations and finding ways to get patients coverage or find ways to deny. You can do either one, but she loves saving money. I don't know if it meant she got a higher bonus each year or what it did, but she was good. She was really good at saving the group money. Millions of dollars. She was really good at it. I mean, if you're a company and you're for profit, she did a wonderful job. She did a wonderful job. But my goodness, I couldn't handle it. We are absolutely going to keep our B and D simply because numerically they start out with the same answer. I find that a lot of, and even CS exams do this too, that they have 2 answers that are just giveaways and then 2 answers that are super close, and they want to know if you know the difference and would be able to pick those out. Just looking at the diagnosis, a lot of times the 9s are non-specific and then the 3s are better, but I'm concerned about this one because we only went out 4 digits and this one went out 5 digits. So, but it ends in 9, which is usually non-specific, but I don't know. It's easy just to look at the difference between D30. You don't even have to go down to the 0.3 and D49 just to see what those differences are. And then check your question to see what it is. If you're a gambling person, you can usually bet against the 9s, but I don't know. Let's go into the D's. D30. D30 is benign neoplasm of the urinary tract, right? Or urinary something or another. And then D, what was the other one? 49. She loved denying the penectomies, the ones where people lost a lot of weight and they need a belly tuck or whatever. She loved getting out of those. Neoplasms of unspecified disorder is the 49. 49.59, since it's on the same page, it does say genitalia organ, genourinary organ. What is my 530.3? Since I looked up the other one. Benign neoplasm of the bladder. Are we bladder or are we genourinary? Whatever. All right. Let's check out. We have urethra and bladder tumors. You really hope so, because that would make sense. I don't know what. I missed it. Yeah, but we've got ureter too. They did. She loved it. And some people just really revel in professional accomplishment. And it could have been just pride over doing her job really well. I don't know. Urethra and bladder tumors. Which one would you pick? This one just simply states bladder only. Ooh, I still got my ear pods in. No wonder I can't. I'm talking really loud. I'm sorry. I hope I'm not screeching in your guys' ears. I don't have anything on, like no music, but I still had them in my ears. Oof. All right. And then this one has the whatever, bladder. I think I would pick D just because of that. What do you guys think? I'm pretty need your live. I'm wondering if I should take a local college course or AAPC. No, Mama, you don't need to at all. All you need to do is watch my 3 pinned TikToks that are pinned, and it'll tell you how to start. Don't pay for a course. I don't think you'll be happy with it. Watch my 3 TikToks. Join my website. It'll go along with that to help you out. It's just medicalcodingbyjen.com. I don't send you or capture all this information. I'm not going to spam you. But all my social medias are there. You can please join the Discord group. Download that app and join it. You'll know when I go live here. And then I have all the steps for prepping your material and getting ready for your open book exam right here. Super helpful. This is step by step. You just click on a picture and then it gives you the instructions of what I'm doing. So go there. It's all free. The Discord group is all free. And you have tons and tons and tons of rooms. I'm sorry I haven't gotten to everybody's messages yet today. I'm working on it. Tons of rooms here divided into sections of the exam that can definitely help you. We even have practice exam question rooms. Tons of help even after you pass with CEUs, job placement, you name it. We've got it here. This is where it's all free, super helpful. Oh, look at Twinkle. She's my girl. Thank you so much. I can help you pass without a course. What I'm doing here is teaching you how to look at these questions and be able to pick out the answer without reading the questions and without knowing anything about medical coding. Once you get your certification, you're going to be applying for jobs. Those jobs code differently, just like other people were saying in chat, based off payers. They're also based off of contracts they make with those payers, which are all different. All of it's ununiform, none of it's universal. Even their EHRs are all different. The way they send claims, capture claims, everything is totally different at each unique physician's office or group or hospital. So they're going to have to teach you their systems no matter what. And nothing in any course is going to teach you and how to be prepared for that. You need to learn some vocabulary with it. You know, what is a claim? What is a CPT? What is an ICD-10? Those kind of things. But you can get that from YouTube. So don't buy a course. You can buy a study guide from AAPC. Don't really care what year you get, but get their official study guide from any used place. Super helpful, has all those vocabulary terms in it that you could use. And that's all you really need besides your reference material that you'll need to take with you during the exam, which is your CPT book, your HipPix, and your ICD-10 book. The rest I can teach you for free. Don't stress about anything else. Of course, it isn't going to prepare you, and it isn't going to help you pass this exam. What's going to help you is watching my lives. So, for the first answer here, do you see 2 answers we would keep? Thank you for all the taps. We got 5,000 likes already and 16 shares. Y'all are awesome. We're going to break the share record today. And 15 stockings already. Wow. Thank you, guys. Yep, we're going to keep B and C because those 2 are super close. Just looking at them as numbers. That's all I'm doing right here is looking at numbers. We got 555. We've got, let me move this. 3 of them are 2s. Thank you for the stocking. I would get rid of A because it goes to the 3. And then right here, I would get rid of that 0 because it's not like the other one. I would keep the 523s because they always do 2 codes that are super close. They just want to know if you know the differences. So right here, I would go to the 52310. What's going on with that one? 52310. What is our one-word difference between that one? It is, we're under this one. The 10 is a scope, of course, but the scope is going through the urethra. That's important, and it's a foreign body or stent replacement. The 52332, where are you? 32. These are new questions I've never done before too, so. All right, this one's also the same sort of scope. It's also a stent. Our differences are indwelling catheter or not. Did we use a catheter or not? That's simply the only difference. Did we put in a catheter? So what's our procedure? Our procedure is a pan-cystoscope. What is a pan-cystoscope? What does that mean, guys? Anybody know? It's also a simple procedure, yes, on that 10 one. Our 32 is not. Pan means we have a wide camera on our scope. It just means we're panning around. We can turn our camera around. So technically, both of those CPT code descriptors, the 10, it says cystourethroScope, but cystoscope, and then the other one says the same thing, but it's a cystoscope. So it's still this word. It just has the urethra in the middle of it, and this just means your camera can pan around. Kind of cool. But what we need to know is, did we do a catheter or not? And we see right there we did. So you know right away that your answer is going to be B, right? And that's the only word you needed to look at. Now this case goes on for days. It's pretty long. But a lot of things you don't even have to look at and read nothing other than the beginning part of your test question on these cases to be able to answer these. Now, if we're in urology, What is the most common modifier we might use? Or do we have anything in that 3-2 to indicate whether we could use a modifier or not? If we look at our 3-2 descriptor and parentheticals, we really don't have much notation, but if you have a copy of my notes, which are on my website in the shop, you would know that this one happens to be unilateral. And my notes also say that if it's a bilateral procedure, we can use our 50 modifier. So right here, we do have the word bilateral, so probably we could use A. What would be our second code in this procedure? If we're looking over here, let's see. We've got two that are in the 2-3s also, but like somebody said before about being a separate procedure, we know and we need to be careful about coding something that is in the same area as other ones. If we look at our 52310, it was in the other answer and we skipped it because it is already a cystoscope, and it's just a cystoscope without a catheter. So we know right away, looking at this, we've already looked up this code and eliminated it. Now, if we were looking at these codes to see any similarities, we wouldn't have one anymore. What is our 5200? 5200? That's the same procedure that the 10 is, because the 10 is right underneath it. They're under the same header, so we absolutely wouldn't use that one either. Our 52351, is that one underneath our 52332 that we just used? I don't know. Where's our 51? Yeah, there's no header change. If you look at our first CPT code, it was the 52332. There's no header change. And our 51, even though it's on another page and 3 columns away, it's still a cystourethroScope with a ureteroscope and a polyscope diagnostic. Did we do that here? No, we didn't. So we can get rid of that one. So whatever this 52234 is, we probably did it. Let's go look. We don't. Now, normally during the exam, don't go look. If you've eliminated D, C, and B, don't look. Just pick A and move on with your day. Do not go look. But we can look since we've got all the time in the world. Our 3-4. Is frugulation. Anybody remember what that is? That is like a laser surgery. We're going to use some heat or electricity, and we're going to burn some stuff. So if you wanted to see if we did that, probably those tumors that we got rid of, we probably burned the heck out of them. Let's see, where do they get down to the biopsies? Look, right there. There's frugate, whatever that is. It just means electricity. That's all. You know you did it. So, easy peasy. If we are using 2 CPT codes, what would be a modifier? for the second CPT code. Without worrying about anything else other than you have two. Thank you for the hot cocoa. Richie's got it. Thank you for being a TikTok subscriber too. Awesome. You guys are entered into a contest. Bunch of contests. I got a bunch of them. I'm moving you guys from the cookie jar to an online wheel thing that will automatically pick it out, so I don't have to write down everybody's name and cut it out and fold it and put it in there. I am moving y'all to a wheel, but yes, our 59 modifier is what you would use for a second one, right? Normally, I mean, that's just in general what you would use, and without using much brain power, it's probably a 59. Just thinking. Anyway, let's go see how we did. Let's see our diagnosis. I mean, this one was bladder, or this one was urobladder or something or another, was our only difference. Let me grab and get my other thingy. And we were the urobladder thing. This one over here, we picked B. B is right. Our modifier, 50, was right. So if you haven't, write down that this code is unilateral, and then right beside it, it's okay to use 50 modifier with it, because that's not in your descriptors. That will help you out during exam. Our 2234 is correct. That is what we did, because we electrocuted those tumors. That was a separate procedure. We had to drop our scope procedure that we were doing that introduced stuff into the kidneys and bladder or whatever, which was those stents and that catheter. And then we grabbed the electrical instrument and we started shooting some electrical beams down in there to cut off those tumors. So that was a separate identifiable procedure. And when we do that, we always will add our 59 modifier to that for the CPC exam. Now, in real life, that is the most misused modifier in the world, and usually one that most health plans will not use. But CPC exam loves that sucker. Thank you for sending me the likes. Hey, Mel, how's it going? Another one of my TikTok subscribers. So I hope this was helpful and wasn't too confusing. It's pretty advanced for the CPC exam. This is a specialty actual question for if you wanted to go into urology and be a urology specialist coder. This is where one of those questions came from, but I thought it was cool. I liked it. And there are cases on the CPC exam. Everybody's saying they're super easy. I just wanted to go over a couple of them. I've got another one here. I've got a circumcision. So knowing that and seeing that this circumcision is being done, what do you think our diagnosis code is going to be for circumcision? And what I would do is simply thinking about the sections in the ICD-10 book. Anything with an N diagnosis, starting with the letter N as in Nancy, if you turn to any page in your ICD-10 book and look at the sidebar that's in green, it says the genitourinary system, right? Z's we know are usually status, like they're here for wellness or they have a history of. Our L's, A, B, C, D, E, F, G, J, L, M, N. L's are skin issues. So, if we're doing a circumcision on somebody, which diagnosis code do you think? You like the graphics? I get tired of doing it the same old way all the time, so I like my little graphics. I did one on a Zoom presentation with our anatomy one time. It was fun. I still have it somewhere. It doesn't take much longer than doing it the regular way. Everybody likes the N. Lady Love picks N. I didn't see anybody else answer, but I will circle her answer. All right. What is AAPC's favorite circumcision CPT code? I think I've said this just once or twice, but they do actually have one little old circumcision code that they pick on and is usually the answer more than any other CPT code they have listed here. They're always trying to make you pick other ones, but yes. Sonia, I'm going to pick you. She said C. That is their favorite one. If you're taking the CPC exam, all their practice questions lead you back to 50. Even though, look at all, if you're doing the process of elimination right here, it would make you get rid of that one, right? Because the 60, 61, and 63, probably the 60 and 61 is what you would keep for the process of elimination. But circumcision, man, they love that 50. They love it. They love that code. And this simply means that did they use a clamp or not? If they did not use a clamp, then you're in another code, right? Now, what is their favorite modifier for circumcisions? They have one. It's usually always in the questions. It's also in the parentheticals. What is their favorite modifier for circumcisions? J3 Squad has B, which is correct. It's right there underneath the C. It's one of the second parentheticals. They have the 52 right there. Now look at y'all answer 3 case questions for AAPC without reading anything of the question. That's how you need to do the CPC exam when you're doing it for certification. Find, what am I doing? I'm doing a circumcision. Then simply look at the header of each one of your diagnoses, especially if they change, that sidebar. What would a circumcision be? It wouldn't be skin related. It wouldn't be a wellness exam or a status. It's about that urinary system, right? Their favorite code. Now, we can verify, picking this and running is pretty scary, but all we got to do is go find, did they use a clamp or not? If they did, we're right there in the 50s, because the other ones, the 60s, they don't use any clamps. Neither is the 61. So you need to be a little bit sometimes of a thesaurus and know what different words mean that might mean clamp, because sometimes they don't use the word. But we can just look through here real quick and see what we did with that procedure. How did they marked the skin, blah, blah, blah. And they marked it. What did they do? They did the incision, and they did that dorsal split, which is right there with that 50. It's dorsal, but so is 60. Both are dorsal. Both are dorsal slit, actually, too. Even though 50 doesn't say slit, but 60 says slit, they're both slits. That's what you do with the dorsal skin, is you slit it. So go right slit next to 52, just in case you don't have it. But how did they deal with that skin after they did that slit? They used forceps. Is forceps a clamp? Sometimes they just make an incision and cut it off with scissors. This one, they used forceps. That word forceps. Scalpel is going to be on all of them, both of them. Scalpel is for both of them. Don't worry about that. That clamp is the only difference right here. Both of them are dorsal slits. That means they use a scalpel to get it going. Both of them are. The only difference is other than clamp. This one uses a clamp. What's another word for clamp? Forceps. What's another word for forceps? There's lots of different words for forceps. Gosh. Hemostats. If they had used the word hemostats, anything. All you got to do is when you see circumcisions, go look for dorsal or incision and see if they used forceps, a clamp, hemostats. If they used anything like that, then it's going to be your 50. Anything other than those are going to be your 60. You're welcome, J3. I'm happy to help out. There is an easier way to take this exam. And I've been through the CIC, COC, CPB, CPMA course, and some other courses from AAPC. And I thought, if I had to use that course to pass this exam, I would be so upset, especially if I paid $5,000 for it. There's nothing in that course that's going to help you answer these questions, I promise, except for the extra practice questions. And what you need to use those questions for is to learn the process of elimination, thinking about going to the answer first and trying to guess what the answer is without looking up anything in the question. If you do look up anything in the question, you ain't reading nothing about the history of the patient, what's going on, nothing. You're looking for those one-word differences that you've already written in your CPT book, which are the differences between those codes. And other than just having hemostat, forceps, and clamp written underneath the 50 is really all you need. Because the 60, 61, 62, all those aren't using anything like that. Yep. Oh, let's check our answers since we're here. Of course, Miss Love got it right. Our code is, of course, right. And our modifier is right. Put on this page, favorite modifier. Is it always used on the CPC exam? Not always. So just make sure you know the difference, that if it was performed without a block, a ring block just means we used lidocaine on the patient to numb that area. So if they didn't block the area, then we use the 52 modifier. All right. This is my E&M one. What did I do here? Oh, okay. So I've got all the answers first. So these are all the answers. The case will be down here. So they're wanting to know, what was the history level? Only the history. Just the history. We have 3 components with doing somebody's E&M visit. It's history, exam, and MDM. Right now, they're only asking us, what kind of history did this patient have? If they had no history of whatever's going on with them today, then it would be problem focused, or it would probably be lighter than that, a straightforward exam or something like that. But if they had a long history of this being seen by this doctor for the same thing over and over and over again, they could end up, detailed or whatever else. MDM is based off all of them and the risk level that the physician faces by whatever the physician did, whether it was medication, reconciliation, or writing them new script, or ordering a bunch of lab tests, or not doing anything to the patient. It's still a risk. And then all of those combined will influence which one we bill. If one of these is super low, if our problem history is problem focused, but our exam and MDM are both high for like a new patient, we couldn't bill an 85 for it. We would have to bill, an 82 because our history brought us down. So those have to be all correct and in a line. You have to meet or exceed a level in order to bill it. And then they want to know what UTI, the acronym, means, which is super easy. So we have a chief complaint of abdominal pain. Let's go down to our history. Let's see, do we have a history here? We have a review of systems, and we have a past history and a medication. All systems were reviewed on the review of systems. Past medical history is significant with kidney stones, anemia, and bypass surgery. So, significant. What does significant mean in the whole scheme of things of history level? With the added review of systems all managed to be reviewed for history. Physical exam. Don't really have to worry about. We really just need to worry about what was ordered. So we got a UA. We have a CBC. And let's see, MDM. Did they say anything about the MDM? Discharged home. Placed her on a new med. Gave her a prescription for pain also. Have her follow up. Left kidney stone with renal colic and sent her home. Didn't even do lithotripsy or anything. Oh my. Just pain meds and sent them home. Let's see. Kidney stone protocol demonstrates left-sided renal stone. Interpreted by the radiologist. Lipase is high. Crappy care this patient got. All right. What would be our history level? What do you think? Would it be problem-focused, expanded problem-focused history, detailed or comprehensive history level? Sonia says C. Somebody right above says expanded problem-focused. It said significant history. All right, we'll circle detailed. Our MDM for the ordering of the test and stuff. So doc reviewed and ordered a UA, a lipase, a complete metabolic panel. That's all blood. That would be all combined into one. They did do a CT scan. So we've got urine, We got blood, and we have CT scan, and we ordered 2 meds. What would you call that MDM? Straightforward, low, complex, moderate, or high? Becca, somebody passed. She took it yesterday. Oh, that's so great. I hope I helped out just a little bit. One of my very first people that I helped was a CCS. Her name was Janet. I even made her moderator in Facebook. I miss Janet. She's gone on to do bigger and better things. Congratulations. Everybody's saying C. Y'all are saying C's. I'll say moderate. So if we're detailed history and moderate MDM, what would we bill? What would match? To 84? Does 84 have a detailed history? $284. Remember, if one's low, they're all low. 284. It does. It has a detailed exam. Okay. Let's see. Anybody know what the acronym UTI stands for? A, B, C, or D? You think it would be B, though? All right, Sonia, she says A. All right, let's go up to the top and see if we got it right. It is a comprehensive history. The reason it's a comprehensive history is because I added some more information because I knew y'all be getting it wrong. It's a comprehensive history because we have an extended HPI, a complete review of system, and a complete PFSH. We went through the patient's family history, their past medical history. Where's the family history? There's somewhere in here about her family history. She denied pain meds. Where is her family history? There's a review of systems. They went through, there it is. It's going to be social history. They went through social. They're saying they went through all of it. Or social history. Yeah. They went through all of that. If your patient has PFSH of just 2 to 9, then they meet the qualifications for comprehensive. So her social history and review of PFSH. I'm trying to think of a better way to describe what the doctor meant and how the chart correlates. past family and medical. I'm still looking for her family in here. I know she has past medical history that was significant, and we did her social history. Where's her family? Just trying to find it. But that's the only one that I'm missing is family, but it may be in here somewhere, but I'm not sure. But they claim it's in here. Just don't see her family history. Do y'all say it's lower? It's down here? Diagnosis, abdominal, lungs. Okay, well, we'll just take their word for it that family history is in there somewhere, and I'm just not seeing it. Aw. Sorry, TikTok mom. I hope it gets better. You were word searching. Yeah, me too. All right, so this one we're going to switch to comprehensive, which might end up changing some of our other stuff. This one, we picked moderate. Our answer is moderate, so that's cool. And which E&M do we want? We picked 84. We did get 84. There is some more information for the MDM right here. So we did get it right anyway, even if we... Come on, you can go somewhere else. There you go. It is moderate because we have a new problem for the examiner. No further workup is planned. They did 2 points for ordering the labs. That's the urinalysis and the blood work, because we get urine from one different type of source, and then we get blood from another type of source. So that's the 2 points for lab. The CT scan gets another point, and then the prescription drug management, the 2 prescriptions. And then y'all know what UTI stands for, which is A. I just don't know where their freaking family history is. But still, with the past and the social, you still have 2 PFSH, which is all you need to meet that qualification of being comprehensive, or, yeah, because there's none of that in a detailed or expanded problem focused or problem focused. None of those have any family history or social history. So just going over the past medical history and social history of our patient makes your PFH, whatever that is, comprehensive no matter what. Kind of weird. I think they might be changing some of that. Don't know. Maybe not. We'll see. But it's really hard to code off of PFSH and the ROS and the HPI by yourself. It's usually not on the CPC exam, but I like playing around with it. If you're going to do COC or CPMA, this kind of stuff can be on it. And it was on for this exam for that particular certification. The CEDE is where I got these specialty questions from. Somebody said today that Pocket Prep updated for them, but it didn't update for me. I don't have any new questions, but I don't know if any of you guys have seen new questions, or maybe they were just talking about the download app. Maybe it updated, but I don't know if anybody else has seen any new questions come through. You've been in the medical field for 18 years, probably instead of hours. I start medical coding next month, and you're so nervous. Thank you for the candy canes. Those are so cute. Robert, love it. Thank you. Well, be sure and save all your practice exam questions for sure from the course. That's what you need. I'm just checking out chat, seeing if there's anything I missed. Hey, Sabrina was answering 10 of 10 can confirm. That was TikTok, Mom. Yes, years. What is the meaning of PFSH? Yep, past, family, social history. It's the review of 3 areas: the patient's past medical history, past illnesses, past operations, past injuries, past medications and allergies and treatments that they've had before, that kind of stuff. Their social history, have they been homeless before? Are they currently, that kind of stuff. And their family history. Does your mom have cancer? Those little sheets that the doctors never look at, but you sit out in the waiting room and fill out that, my brother had this and I've had this and my Aunt Sally Sue had this, but nobody reads. Yeah, that stuff. Be sure and check out my website. We've got all the social media, which is here with the YouTube. YouTube subscribers are really cool. They get copies of my workshops, copies of the lives that I do book prep. I think I did. Did I do book prep last night? The days are running into each other. I think I did it. I don't know. It was either last night or the night before I did book prep. And so that saved and went to the subscribers, or subscription holders. I don't know if I'm saying that right. The ones that pay the $5 a month to subscribe there. They get extra stuff where they can watch me make notes in my book that are easy to help you out during the exam, code by code. They also get entered into the contest. Facebook group is there, TikTok is there, and the join button for our Discord group is there. Super helpful. And when I go live is there too. Also, if you become a member of the website, which is really cool, you get the CPT book prep page, which is copies of my notes. If you just click on the pages, it'll tell you the instructions on what I'm doing and why I'm doing it. And then that way you can make your notes just like I made mine. And you don't, you'll get to know how to do all this, even for the ICD-10 book. Super cool. Then I have some pages that are just cool. How would you deliver babies and what would be the answer? Just helpful stuff right there. What's the difference between a mama code and a child code that I talk about all the time is right here. Other things, I've got the blog that's all free. I have some book prep videos that are free there. Workshops and tutoring is here if you ever wanted to do that. The shop does have copies of all my notes. If you want them, they're there. I have additional educators that are in the field that also do teaching, just like me, and other TikTokers and stuff like that right here. If you have anybody that you watch and should be listed here, let me know and I'll add them. What else do we got? Our Discord group is so handy dandy. That is just too cool. We're always in here for you guys that are taking courses. If you don't know the answer to one of your questions, you can come here into Discord, go to the practice question room, just copy paste something in here about your question, and somebody's in here 24/7. Somebody will answer your question and give you the answer and let you know why. Super helpful resource. if you don't know the answer to something or just want to know what something is, just come here and post it. Can you please help us with this? Which ICD-10 would be impending pneumonia? There is no impending pneumonia code, actually. The only impendings we have, by the way, are in our easily found, no matter what book you're in. I happen to be throwing the 2023 up here because my other ones are right here holding another camera. But if you go to the word, as far as I know, there isn't one. I don't know. I'm not a coder, but I don't think there is one. But if they don't have it, then you can't code it. But there's only 3 diagnosis codes that are under impending. A, B, C, D. If I could spell, it would be better. IMP. And one of them is just technically written twice, really. I am impending. It's always going to be over here, huh? On the page where I can't show you. I am PEN. Impending. I don't know. Impending? Maybe this is just all cardiac. If we were going to have one, it would be under impending, and you would see it right here. These are the only ones that I know of. Maybe. If we could look up in pneumonia and see if there's an impending underneath it. But these are usually asked on the CPC exam because the coronary syndrome is the same thing as a heart attack, and you can code them with an impending heart attack. If there was one, I don't know, I bet if we look up pneumonia, we probably get crap about look elsewhere, but I don't know. Pregnancy. It's every time you look up a regular word, you just get told to go somewhere else. Let's see. Probably A, B, C, D, E, F, G, H, I, J. I know we have pneumonia. Pneumonia is going to be 18. It's probably just going to be unspecified. I don't know. Would they code it? I'd have to have these books to see the AHA to see if they would do pneumonia unspecified, or would you do the other? Can you do impending? Is it here? See guidelines from, no. We don't have ventilator. Code first. Influenza if it's there. Ugh. I wonder if you could code them with pneumonia when they don't have it yet. They're fixing to get it. I bet you can't. I bet you got to do a multi-system thing, a URI or something like that. That would drive me nuts. I don't know. As an auditor, I have a problem. If I was going to use pneumonia code, I would use non-specified. Query the doctor. Dude, I can't call it pneumonia. If you say they ain't got it yet, tell me what they have then today. What do they got today? But it's a good question. but I think unspecified. And it depends on what A, B, C, or D is too. So Google might be helpful. I wonder if AAPC has a knowledge center about it. No, they don't have an article on it. They got one on COVID. No. Unspecified organism. 0.9. Yeah, it'd be nice if it said impending, but I don't see one. Same thing. Query the doctor. Yeah, I don't see anything, but good question. Hey, Sonia. Let me answer this one. J, what did I say? J 18.9 or query MD is my best suggestion. Woo. All right. Don't forget AAPC actually is pretty cool with, I know I'm trying to buy more crap from them. Lord help. A lot of people had questions about what I posted today about the December 21 practice questions are going to go away any day now. Today's December 16th. So these practice questions right here are going to be deleted any day now, and we won't be able to see them. There was quite a few, I thought E&M ones. Yeah, like this one is a nice E&M question with rationale. So if you wanted to capture these free 20 questions right here, what you do, and if you've already a member of AAPC, you've already paid for your membership, all you've got to do is go to their site, go to training. I hope y'all can see all this. Go to CEU search. Go down here to low cost. Then click this little words right there that say Healthcare Business Monthly. Click that. Then you're going to go here and you're going to go all the way down to 2021. Pop that open, and then the last exam is right here ready for you. You'll have to take the exam, which is cool. They give you unlimited tries. Even if you just go through here and practice and try to answer them, that's cool. If you get it wrong, it doesn't matter. Just hit grade. After 3 attempts, they may, if you still don't have all of them correct, they may make you wait an hour before you retry again, but that's okay. Just go back in an hour, get it all done. When you get it done, then all you got to do is just copy the questions like this and hit Control P. And then just change your setting right there to selection only. It'll change your format so that it looks nicer than without it, with all the advertisements, you know. And then you can just save it on your desktop, and then you can look at the questions and answers later. Unfortunately, you can't see the rationale on this print page, but at least you've got the answers. But you can go back in, open that into Word document, and then go in and look at each individual rationale later and copy-paste them in there if you wanted to. But these questions will go away. Nobody will see them again. And if you do go in here and look at all these, keep in mind that you don't want to do all of these. Don't do January, February, March, April's unless you've passed. If you passed your CPC and you need your free CEUs, go here and do all these. This will get you 12 of them. Used to, we could go back any year and see all of them. But now they got privy to us getting to CEUs too easily, and they cut us off where they only allow us to have 12 months back. So this one will go away any day now. Be sure and go get that 2021 one. And if you have not passed any at all, don't do these Januaries all the way up. Just save them until after you pass. That way you get these free right away. You're not paying for webinars and crap that are super expensive. So if you've already passed, this will get you 12 of them. And I've got the answers if you're struggling with any of them. If you're having trouble and you need help, I can help out. But this gets you 20 more questions. If you want to go in here and you want to grab the questions, even though you haven't passed your CPC, but you want to see what the questions and the answers are, but you want to save the CEUs, make sure you answer 2 questions at least wrong every time you hit grade. Like, let's say you know the answer to this one is an emergency trach. You know that. I've done that question. You know it. And you know this one is clinical management. Leave those 2 as A, and then you can work up these questions. You can print them and save them and work on your diagnoses and all the E&M ones without producing your CEU that you can't get back later, because it won't give you the certificate unless you get at least 9 done correctly. So just keep having it grade at least 2 answers wrong. That way you can go through the whole year and you can grab every one of the questions and have 20 each month. So 20 times 12 is I don't know how many questions, but these are all still good practice questions to practice for your current CPC exam. Just be sure and get 2 of them wrong each time you hit the grade button so you don't lose those CEUs. Oops. I'm going to take y'all down and see if I can't read chat, because I know I missed some stuff. She's glad she asked. Can someone update me new here? Hey, Blaze. How's it going? You can't even find it on the website? Oh, no. The online exam is not done in 2 parts anymore. It's done in 1 part. 4 hour long. They no longer let you do 2 hours one time and 2 hours the next. They made it all 4 hours. Please show us the steps. Yes, I can show you the steps. So just go to the AAPC website, which is aapc.com. Just simply that. Go there. You're going to click on training and events right there. Click that, you'll get this drop-down menu. You're going to go all the way over here to the right and hit CEU search. When you get here, there's 9 or 6 boxes. You're going to go down to the last one right here that says Other Low-Cost CEUs. When you get there, you're going to find this small, little, bitty healthcare business clickable link right there. Y'all, this was, as an AAPC member, just finding what benefits you do have, it's not the most easiest to find, Click there. And these are the magazines are here. You can go into your account somehow and you can have them forcibly mail you a printed copy of these magazines, but the default is that you can download the PDFs And they're right here. And by the way, the PDFs do not instantly download. It doesn't work. None of them will. What I figured out as a hack to be able to look at the magazines in PDF form, because I hate the e-magazine because it makes noise every time you click into it to turn the page. It makes a turn the page sound that's fake and loud, and I hate it. Anyway, right click on this and click on copy link address. Open up a new tab on your browser. Make your browser incognito. Click the link right there and paste it in there. Hit paste and hit enter. The next thing you'll see is down here, it downloaded as a PDF just by doing that. And then you can click that PDF, and then you get the health magazine as a PDF that you can scroll without those stupid turn the page things. But yeah, I'm crazy with IT stuff, so I don't know if anybody can follow along with me and what I just did, but I don't know which tab I was open on. Let me go right here and go back to the low cost and go back to the magazine. And then these are the magazines. If you open up the magazine in the E format, this is what it looks like. And you got to log on again to see the stupid page, which is funny when you're already logged on. But when you click on any of these pages and move through it, it makes loud noises. I don't like it. Anyway, I like the PDF form, which is right there. And the PDF form is a lot of advertisements, but sometimes they do ask or give you some information on how to code stuff. And of course, it's where the answers are to these questions for that month. They're in there somewhere, and you can do a Control F and find them. But this download thing has never worked for me for some reason. I don't know why. How do we save the test answers? Well, after you hit grade, right, you've already got it graded. Hopefully you've got 2 of them wrong. Like I said, you just start and put your cursor right there at question 1, highlight all of it, and then hit Control button and then P at the same time. When you do, you'll get this print thing that comes up. Don't print it to your printer, print it to Save PDF. And then change your settings so that you don't get all the advertisements. Change it to selection only. That changes it from the advertisements, which is fine even if you do get the advertisement, but that changes it to a bigger thing. And then just hit save, and it'll save on your desktop wherever you want to put it. You can put it anywhere, and you can label it. It already comes pre-filled out. I usually just put the month and year so that I know which one is which month, and then hit save. Then you can open it back up later. Let's see, where's my PDFs? Let me see if I got one, probably. Yep, I've got one open right here that I did in that format. Then you can either copy, paste them into Word document, and then, or you can open this document in a Word document if you wanted to, too. But yeah, you can take them, and for like what I was doing today on our lovely urology thing, you can take it after you hit copy and just hit paste. The best paste is the last paste. It does the best. The other ones get kind of crazy with their formatting and stuff, but the last one is the best one. Anyway, and then you can format it however you want to. And then you have to go back and go get your answer, because when you copy paste off the PDF, it won't tell you what the answer is like the PDF does. Then you just go back, grab your answer one more time, go back down here, and hit paste. Be sure you are only using these for your own personal use. Do not resell these over the internet like somebody else does, word for word. I would not recommend that because that's not cool. They are copyrighted by AAPC. If you need help with those questions, of course, you can post them in our study group and get help with them. But do not, do anything ethically that will harm you, and they can take away your CPC too. So you don't want to get caught doing anything or openly sharing these over on a document and then letting everybody download it off the internet. That's not cool. You could lose your CPC for that. So y'all went through a lot of trouble and spent a lot of money on it, so don't do that. But we can absolutely use them for individual use, your own study time, and we can use them in our study group as a whole, just as studying with each other. But don't collect them and download them and openly share them over the internet or on any of my sites. If you write your own questions, great, and you want to share them, then perfect, but don't use their copyrighted stuff, please. We don't want to get in trouble. And if you do, by the way, resell anything that has a CPT code and ICD-10 code in it, just so you know, you do have to go to AMA, you do have to fill out a franchise form, and you do have to pay them a yearly stipend to be able to sell anything with their codes or descriptors on it. I have to upload them documents every quarter to produce anything with these numbers. The entry fee yearly is $1,600, and then every quarter they bill you based off of everything else. So don't forget, if you are thinking about writing your own notes or producing anything, there's a whole lot of other things that goes along with all this, just in case. And that can be found. I had to look for it the other day. I wonder if I still have it. Nope, I got pizza up. I wonder if I still have it right there. I have it still up. This is the CPT from the AMA who needs to have a license. And these are the people that you talk to, and you fill out the form right here. If you do start reselling any training material of your own for anybody, be sure you go and do your licensing fee for that. And, all those AAPC instructors, for them to be able to produce a course through AAPC system for you guys, they have to pay $3,000 franchise fee to be an AAPC instructor. Plus, they have to pass the instructor course, and of course, they got to keep up with their CEUs. So, if you ever thought about being an AAPC certified instructor, just know there's also a licensing fee for that, and that's $3,000 a year. On top of, you'll need to do the AMA CPT franchising fee, which is $1,600 to start out. So that's why they charge so much for those courses, is they have to pay back all those licensing fees. Anyway, that's just ramblings. Let's get back to some practice questions. Yeah, I just want to work from home. That's great. Y'all will do wonderfully. I mean, earning that paycheck from home is the best thing ever. Just make sure you put a lock or a timer on the refrigerator. Oh my gosh. That was the first thing that hurt me, was when I started working from home from 2013 was, not having access to the refrigerator was rough. That It's just right there. It's so easy just to grab a hold of it. But since I met my Miss Edwards, who I've been teaching for, I think since April of last year, she has taught me about juicing. And oh my gosh, y'all, that has been the funnest thing ever. Got a lot more energy doing that. Show y'all, where's my screenshot from this week? Looky. That's this week. Isn't that great? Just because I know Miss Edwards, one of my students. She's on Instagram, which is, her name is According to Tren, T-R-E-N. She's, I'm going to tap on her because she's right there on my Instagram. If you ever watch her on Instagram, she's great. There's her name, According to Tren. She's always fasting. I can't do that. She's stronger than I am. But even if you just replace one meal with juicing, it's so much fun. But anyway, yeah, that's how I was able to do that since I met her. Woohoo! That's been fun. I was a remote stylist for 5 years, laid off in August. Thanks, Cookart. It's great, especially first thing in the morning. You take that juice and you're like all groggy and not awake, and then you got tons of energy. All right, if we are working with this ankle pain, what I see right away is we've got several of the 206s, right? And then one lonely bird that's the 205. Need to see what our differences are. We do have 2 with the same answer, and then the only difference is whether we need to add radiology or not. So the easiest thing would be to run to the 20606, see if that code already includes radiology or not, and then we might know the answer right away. Put y'all back up in the crane. Yeah, it's really nice to be back down to the 150s again compared to what I was before. Especially at my age. I'm in my 50s, so extra weight is rough on you at this point. 206. 206. 20606. There we go. And look at that CPT code. Includes ultrasound guidance already. Technically, we shouldn't be looking at it because it's a child code. We should be looking at mama, but that's super handy dandy. Already we know right away that we don't need the radiology and that our answer is going to be just simply A all day long without reading anything. I wouldn't have even read one word of that question. If you see something like that on your CPC exam, do not stop to read anything. If you see your code includes radiology, then pick the one that doesn't have radiology and move on, because they are going to ask you one of those questions, and it's like winning the lotto. You don't need to read anything of that question at all. And when y'all do get that fancy job working from home, don't forget, you don't want to gain a bunch of weight sitting at the desk at home. Take it easy. Put a lock on your fridge. It's just too close. But man, at the crock pot dinners I made, because you know, when you work out of the home, it's really hard to get everything into the crock pot and set it to working before you go to work. But if you're working from home and you're in between calls or fixing to go take a bathroom break, you can throw something in the crock pot really quick and then while you're in the between. And then you can get your laundry done. You can start laundry on your next break. Now, folding it and putting it away never got done, but at least I always had clean towels and clean laundry. It was all done. Love it. It's still all done. It's just not put away 100%. All right, we've got all these up in the 0 zeros. So let's run there and see what's going on with our 277s. 277s. What's going on there? I have an internet phone with my job, which is kind of cool. So even if I'm not at home, if I'm on vacation somewhere, as long as I have a connection to the internet, then that internet phone connects to my office, which my staff can just ring 261 or whatever and get my line no matter where I'm at. So that's always nice and handy. They've come up with so much fancy stuff over the years that you don't even need like a cell phone, that they'll call you on your work phone. All right, 2770. We're under the arthroplasty. Is that what we did? We did do an arthroplasty. Which one has implant? The O2 does. That one was super easy, just based off the CPT codes. Yep, easy peasy. Let's see what's going on with this one. 213, 10, 15, and 25 are the closest. Let's run to the 10. 213. 213. I'm going to do some more book prep tonight before I get off here on YouTube. So if you want to see book prep done individually, code by code, you can all watch it free while I'm doing it. But then the YouTube subscription people get to watch the replays at any point whenever they get ready to. So that's going to be going on when I get off of here. What time is it? Pretty soon after this question. So we'll just go do a personal break, turn on some dishes, swap the laundry, grab a drink, and I'll be back to do some CPT book prep, one-on-one codes on YouTube, but you all are invited to come watch that. Let's go to 10. Where is that? 1, 3, 10. Our 15 and our 25. Our 15 is a closed procedure. 25 is an open procedure. 10, that sucker's been deleted, right? Old question. I'll have to change this one. Let me change it. What have we got here? Our answer, okay. And then if I didn't know, what would be harder for me to do? Let's change this one to 30. There we go. So now this one is also open. That might be confusing. And then our 37 is also closed. So let's see if our procedure. Now, be careful. Be careful on your exam, because let's say this is your arm, right? Those fingers, oh my God. And this is your elbow, okay, going up to your shoulder. If you fractured your arm, your fracture, that bone, could be a closed fracture, but then I go into your arm by cutting it open to fix the fracture. So don't just look for the word closed and immediately think your procedure is closed. It could be just the fracture is closed. Or it could be the opposite. Your fracture could be open, your bones are all sticking out, but they don't open you up to fix it. They don't have to. They can do a closed procedure, which is just pulling your arm apart and popping your bone back into place and putting an external fixation device on the outside of it, which is still a closed procedure. So pay attention and don't just grab, because I love word searches, but when you're looking for open and closed, make sure you're looking for the right open and closed. These are open procedures, and these are closed procedures. We don't care what the fracture was. That doesn't bother us at all. Ignore that. So was our procedure opened or closed, or was our fracture open or closed? Reduction is the same thing, aka term, as manipulation. If you do not have that down, be sure and have that. Manipulation is the same thing as reduction. So we're doing a closed reduction, which means our procedure was a closed procedure, which means we'll get rid of A and B. The difference between the 15 and the 37. This is a nose, but it's the septum, which is the divider, which mine is so deviated, it's bad. And this one is a bone in the nose, not the septum. So did we do the bone? Yeah, and not the septum. So you know your answer is 15. So the only 2 words I read, 3 words, in this question was reduction, closed, and nasal bone. That's it. You don't need to know none of the other information because it's just propaganda. See how they're trying to make you think that an external nasal dorsum might mean septum or something like that. But the rest of this is just propaganda. Stay out of it. Don't be looking at it. Only look for the differences in the CPT code descriptors. The descriptor on 15 said bone, and then the one on 36 says septal. Those differences will make the difference. Yeah. Hey MK, how's it going? Thank you guys so much for helping me get to the goal today. I got a package from AAPC. Show y'all what I got. If I can find it all. I tore it all apart. So I won a contest. Ooh, sorry, Lester. Back in June from AAPC, they asked people to share their copies of their notes that they used to prepare for the CPC exam. So, of course, I showed them my notes, and of course, my notes won first place. So I got this big old package, and they never did send it to me. And I kept bugging them and bugging them. Finally made a post about it, and finally they got me in touch with somebody. They were going to try to send me some puffer jacket, and I was like, y'all, I was supposed to get this package with a bunch of stuff in it, and I live in the hottest place in the United States. I really don't need a jacket. I'd really rather have the cups and the notebook and things. If you still have any of that stuff laying around, I'd rather have that than that puffer jacket because I knew I'd have more gifts to give out to everybody else. So they did find something similar. And one thing is this huge bag of some sort. It's really super nice. It's sturdy. I don't know what all it's got in it, but it's got AAPC. It's got place for your tags, and it's got buckles here and there. And I guess it's a laptop bag, but it is super, super nice. So I'm going to give that away. I got a fanny pack with their AC/DC rendition thingy another. If anybody's interested in a fanny pack, that came in. I got an AAPC mug, of course. That came in. And a notebook from AAPC. I think it's moleskin. It's really nice. Moleskin. And a cardigan sweater thing. This is an extra large, but it seems pretty big, like a I don't know if it'd be a 2X, but it's super stretchy and it's embroidered and everything. So it's really nice. So I'm trying to move my cookie jar people, all you guys that have entered into my contest, I'm just typing out y'all's names into this wheel so that I don't have to keep writing. I get so many people emailing me every day wanting their name put in there. So this isn't feasible of me writing names down and then and then cutting them and putting them in here. That's taken too long when I could just copy paste you from the email and put you in my wheel and make it electronic. So I'm moving everybody over there to that, and then we'll have the computer just pick it. I know the kids enjoy picking names, but since I picked a name, I've got Leah James here. Is she around anywhere? I'm pretty sure I'm a cookie jar member. Yep. If you are a TikTok subscriber, every month you get a new name put in extra for as long as you're a subscriber. Same thing for YouTube. If you're 2 months in, then you've technically gotten 3 of your name in there 3 times, because you get once for your YouTube, and then the second month you get it 2 times, and then the third month you get 3 more, 4th month you get 4 more in there. If you just want to email me and put raffle in the header, that helps me out so much, because I know why you're emailing me, because I'm got a huge high volume of emails. But if you put raffle in them, I grab your email address and I can just paste you into my wheel. And that's entry is free. And I'm not collecting any of these email addresses. I'm not going to spam you. You can even use a fake email address. I don't care. All I need is your name. And then somebody will let you know that you won. But I also give away free tutoring from me, one-on-one, and my notes. I usually do these on Fridays where I pick winners, but I want to get everybody's name in on my little wheel, which I will do this weekend. And so that we can do drawings for all this stuff, and we can do more for notes. People that buy the document in my shop for what's been on the exam in the last 45 days, all those entries go into giving you guys free notes and stuff too. So I got all this swag to give away. But Leah James, I want to win tutoring. One of my redheads won tutoring twice on 2 different week Friday pools, and she only had her name in there twice. So it was crazy. That was cool. We got her all done. I think she just took her exam too. So I still have to. A lot of people that have won copies of the notes are waiting until my 2023 notes are done so that they can get a copy of those. But I had some winners of the workshop too. Chavez, yeah, she's waiting until 2023 comes out. I had Desiree Richards, who won notes one of the last times. I still haven't talked to her. Whoever PBB is, won notes. Still waiting on that one. Not really waiting. I'm sure they probably messaged me somewhere, and I'm just overwhelmed with messages everywhere, so I'll eventually find you. Sarah won. Oh, yeah, she won workshop. I already gave her the workshop. Gave everybody the workshop. Charisse. Yeah, she's waiting for 2023 notes, too. Yep. But that's everybody that I haven't talked to yet, or have talked to Twinkle. And then Leah James. Yeah, I got to come up with a better system than these little sticky pieces of paper, because I'm going to lose them, or my cats are going to eat them, or something. It's just becoming too many. And I want everybody to get their fair share and be able to keep a tracking record of who's what and where. And I can ship anywhere, so that's not a big deal. My oldest runs a store out of the house, and we fix people's gaming systems. So my oldest will fix your Nintendo or PlayStation or whatever, fix it and send it back to you. So we've got our shipping going on out of here. It's pretty cool. I like showing up at the post office, especially during Christmas time, with paid postage already on my packages, and I can bypass the line and just set the packages up on the counter while everybody's glaring at me. That's fun. It's nice having your own little post office in the house. Kind of cool. All right. I am going to get off of here so that we can do 2023 CPT book. I hope tonight has been helpful. Well, you send that PlayStation 5 right on over here. Those things are notorious for coming undone, and what a pain. You got to go, you just pop off that white cover, and the motherboard has 15,000 little screws in it, and then one more little component, and then he's got the soldering tools to solder it and make it better, so that if your kids are jerking it out of the back of the system, then it won't come loose again anymore. Yeah, he'll fix it. Fix it right on up. You were quoted $150 to fix it? My goodness, no. That's too much. Yeah, I'm sure John would do it for at least half of that. And then, yeah, at least. And then we got to ship it to me and ship it back. So, I don't know. I don't know what he charges for that kind of stuff. He's also on that site I tell you guys about to, if you have used socks, if you have any Christmas presents you get this year that you don't want and don't want to take back to Walmart or whatever, you can get on this Macari app and sell them. Where is my, I always forget. Oh, selling. No, that's not it either. This site is so cool, but I forget where everything is at. Where is it? No, local shops, nope. Oh gosh, they done updated this stuff. They did update it. Why doesn't it? Oh my lord. I don't know where my stuff is, but it would say $8,000 since they updated it, but it doesn't. I don't know where it's at nowadays. But, yep, he done sold that thing too. But that's his name on McCary too. He sells all those electronics that people sometimes give him or he finds that are broken and he repairs them and fixes them and stuff like that. But this little site is cool. I like it because the customers have 3 days to like it, love it, hate it, and return it. After that, the deal is done. It doesn't matter. There's no 30-day, 90-day, 60-day, whatever stuff with eBay or Amazon. And I've never had anybody, fuss or hate me or anything else. And I've made, in the last almost 3 years, $8,000. And I use it for when membership fees are due, or I need to buy books for AAPC, or my car tags. That's my biggest thing, is when car tags are due. I use it for that stuff. And I just sell stuff that maybe the kids get that they don't like, or stuff that I get that we can't wear. This was a penny item I found at the Dollar General store. Little slipper shoes that I found for a penny. They sold them to me for a penny. So then I sold them to somebody else with free shipping for $9. I probably made $4 on the deal, but it's $4. I turned a penny into $4. They got cute little new shoes, and I made $4 after shipping. It don't bother me. But that's what I got right there. Yeah. That was fun. Anyway, I like McCary. If y'all are ever in the need, people will buy the used toilet paper rolls for crafting, all kinds of stuff. They'll buy off of there. Just describe it. If it's got holes and it's dirty and it stinks, just tell them. They don't care. They'll buy it. Somebody will. People use stuff for all kinds of things. Anyway, I am going to get off here, get a drink, and go get... my cats are fighting. So I will be back on YouTube. And we'll do some book prep. First, yes, we got to pass our CPC exam. Absolutely. I don't know. You need to go find it out. Go look in front of your bedroom door. I'm assuming there. My children. He's like, where are the cats fighting at? You're coming to me to ask me where the cats are at? I'm stuck here on the computer. Yes, it is, MK. We're going to get it done. I promise. 15,000 likes and 17 shares. Thank you, guys. I will post this up on YouTube too, and I will be back on YouTube in about 15-20 minutes. I'll see y'all then.